My name is Elaine Stasiulis, and I'm from the Hospital for Sick Children, also known as Sick Kids, located in Toronto, Canada. I'm a senior author of a paper that was recently published in the British Journal of Dermatology entitled Children with Facial Morphoea, Managing Everyday Life, a Qualitative Study. We did this study for two reasons. First, in response to clinicians who observed that children living with the types of facial anomalies that occur with facial morphoea seemed to be experiencing particular psychosocial challenges. And the second reason was the lack of research literature on this topic. Facial morphoea is a rare chronic inflammatory disorder resulting in fibrosis of the skin and underlying tissue. It tends to present itself in childhood and adolescence, a time of development when facial disfigurement might be expected to have significant impact on self-esteem. Although the few studies examining the quality of life in this population have reported only a mild to moderate impact, these studies have involved only small numbers of cases, and used only quantitative measures, which are limited in capturing the complexities of living with this disorder. Hence, we chose to use qualitative methodology to explore the psychosocial implications that children experience as a result of living with facial morphoea. We conducted both focus groups and individual interviews with 10 children ranging in age from 8 to 17 years and 13 parents of children with facial morphoea. We also asked participants to complete a drawing that represented what it was like to live with facial morphoea, which generated some insightful discussion and reflections about their experience. Overall, our findings indicated that stress was a dominant feature of living with facial morphoea, which was related to the degree that their lesions marked them as being different from others. And this was further intensified by the uncertainty and lack of knowledge about facial morphoea. Perceptions of being different were particularly acute during times of transition, such as when changing schools or during puberty, when, as one young person stated, looking matters a lot. Intrusive questions, name-calling, and bullying also impacted children's identity and self-worth. Treatment effects described as worse than the illness, such as extreme nausea and weight gain, added to children's distress. To manage the impact of facial morphoea, children and their parents used strategies to normalize the experience by hiding physical signs of the illness, such as with makeup or hairstyle, and by constructing explanations about what it is in ways that they hoped would halt further questioning. Interacting with peers or those that were similar to themselves also helped children and their parents normalize their experiences by making comparisons with others whose illnesses they saw as being worse than theirs, or in sharing commonalities with others, which helped them to feel that they were not alone. So this study is relevant to dermatologists and their patients because by understanding the challenges that children with facial morphoea face, health providers can support them and their families by helping them learn how to respond to intrusive queries, developing opportunities for peer support, providing access to resources to help with bullying and anxiety. Thank you for listening, and we hope that you read our paper if you are interested in learning more about our research. Thank you.